Good day. This is Usha Salagame from the New South Wales Centre for Health Record Linkage, or the Cheryl. This presentation is a retrospective analysis of the Cheryl experience in relation to the barriers and enablers for an efficient and successful cross-sectoral data linkage. The Cheryl was established in 2006 as a dedicated data linkage unit for two Australian jurisdictions, New South Wales and the Australian Capital Territory. The two jurisdictions together represent approximately a third of the Australian population. The Cheryl hosts a secure, high-performing data linkage system which facilitates high-quality research and health policy decisions. More than 230 datasets, including 28 core datasets from the Cheryl master linkage key, have been linked on request. Over 2,300 researchers, evaluators, and policymakers from over 140 institutions have used our services. Users of our data have published over 680 peer-reviewed publications. Since 2007, the Cheryl has serviced requests for linked data that include not just health, but also data from a number of other government sectors. This is partly because health determinants or the outcomes of health interventions often span other sectors such as education, law and justice, social welfare, transport, and others. Increasingly, social policy researchers and non-health agencies are also using linked human services data for their research and policy purposes. Some examples of the commonly requested datasets from New South Wales government clusters are listed on this slide. Sharing routinely collected public sector data can be a powerful tool in population health and social policy research. Cross-sectoral linkages is considered by some data linkage practitioners to be more challenging than health data linkage. However, such observations are largely anecdotal and systematic analyses are limited. To implement a systematic solution-based approach, we needed local evidence and a local perspective on issues within our setting. We therefore carried out a retrospective analysis of past cross-sectoral data linkage services to identify local barriers to cross-sectoral data linkage and to explore changes over time. We first reviewed the literature to identify systematic frameworks on barriers to data sharing. We identified cross-sectoral projects delivered via the Cheryl since 2009 to create a case series. Inclusion criteria for a project was that it had to include data from two or more New South Wales government clusters, had to have a written application, and the linkage was at least in part completed between 2009 and 2019. Detailed case reviews were conducted to identify barriers or delays arising in various project stages: application, authorization, data sourcing, linkage, and provision. Each case was rated against a framework of real or potential barriers to data sharing. The definition of a barrier was any obstacle that could impede or delay data sharing or could limit the efficiency of data sharing. The definition of a delay was when the project took 2 months or longer than expected at any stage due to the barrier. Our focus in rating case reviews was only on New South Wales datasets. The case reviews and rating of barriers did not attempt to describe barriers encountered in other jurisdictions or in accessing data from other jurisdictions. We adopted the framework on real and potential barriers to data sharing proposed by Van Panhui et al. This framework is based on a systematic review of the literature for potential barriers to public health data sharing. Van Panhui et al. Identified 20 potential barriers to data sharing and grouped them in 6 categories: technical, motivational, economic, political, legal, and ethical. The evidence-based characterization provided us with a suitable framework against which we could map the barriers encountered in our experience of delivering cross-sectoral data linkage services. To understand the evolution of the barriers landscape over time, the projects were categorized into 3 time periods: projects that occurred between 2009 and 2012, those that occurred between 2013 and 2016, and those that occurred between 2017 and 2019. A prior analysis in 2017 had reviewed projects that occurred until 2016. We extended the analysis to include subsequent projects in the 3rd time period and describe our findings over the complete case series. Each project or case was rated against this framework of real or potential barriers to data sharing. We scored and compared the percentage of projects within each time period that had experienced delays attributable to these categories. Further, we carried out a regression modeling to identify predictors of overall timeframes. That is the elapsed time between when an application for cross-sectoral data was first lodged to when the linkage was completed by the sharer. The time period of the study, delays due to each barrier category, the number of cross-sectoral clusters and datasets, the study population size, and the number of linked records released were all considered for inclusion in the model, and then the best fit model was used to identify the predictors. Coming to the results, since 2007, when the first cross-sectoral data linkage application was received by the sharer, the demand for cross-sectoral linkage services has increased sharply. In the last year, we delivered linked data to over 35 requests from various projects, and over 500 million records were released. Requests were received from academic researchers, government agencies, and nonprofit organizations. The number of linked datasets delivered per project varied between the time periods. Significantly more datasets were linked per project during time period 3 compared to time periods 1 and 2. The median number of datasets linked per project doubled in time period 3 as compared to time period 1. Over half of the projects in time period 3 included 10 or more datasets. This bar chart describes the proportion of cross-sectoral projects that encountered barriers leading to a delay in each time period. Overall, there were fewer delays associated with most categories of barriers in time periods 2 and 3 as compared to time period 1. In particular, there was a substantial decrease in the number of projects that experienced delays due to motivational barriers, such as disagreements and concerns over how the data was to be used, political barriers such as the lack of effective guidelines on data use, and ethical barriers arising out of a lack of clarity around the benefits and risks of data sharing. This slide presents the results of the regression analysis to identify predictors of overall timeframes. We found that time period was a significant predictor and overall timeframes decreased over this study time period. The number of datasets, overall timeframe increased with an increase in the number of datasets. And the number of records received, overall timeframe decreased with an increase in the number of records received. This was an unexpected finding and suggests that the number of records involved do not bear significantly on the time taken for the project. We found through our case series overall fewer delays associated with most categories of barriers in time periods 2 and 3 as compared to time period 1. The improvements and changes that occurred during the early part of the study period have acted as enablers of successful cross-sectoral data linkages. These include law reform and privacy directions. For example, the 2012 Health Records and Information Privacy Regulation Act, the 2016 Privacy and Personal Information Protection Act, and more recently in 2018, the Public Interest Directions, which provides exemption to support specific cross-sectoral data linkage projects. There have been more guidelines and interagency agreements and enhanced availability of metadata. Within New South Wales government agencies, there's a single information sharing MOU, which has been signed off and can be easily modified to suit specific interagency project. There's greater experience and participation by custodians. There are clearer research questions and statements of benefits outweighing risks from the researchers. A dedicated data integration unit within the sharer now enables custodians to share data more efficiently. In summary, the use of linked cross-sectoral data has increased substantially. Barriers to data sharing have decreased over time. The Van Pan-Hui framework provides a useful classification of barriers, although there are other important dimensions of the project that have an impact on timeframes. Identifying real and potential barriers is a useful quality assurance exercise for driving improvements, and work is being done across New South Wales government to drive further improvements. I wish to acknowledge the following agencies for their support of this piece of work: the New South Wales Health, ACT Health, the PHRN, investigators of the projects which comprise the case reviews, and data custodians who provided the data. If you have any further questions, comments, or queries, please contact us by email or visit our website at www.cheryl.org.au. And thank you very much for listening.